Hi, everyone. Welcome to class. Thank you for coming. Today, we're to be talking about chapters 11 and chapter 12. We'll be talking about the schizophrenic disorders, the psychotic disorders. And also in chapter 12, we'll be talking about personality disorders. So a lot to talk today. So let's start with schizophrenia and psychotic disorders. So schizophrenia is probably one of the most talked about psychological, most severely disabling psychological disorders that we know. There probably are a lot more people who are suffering from schizophrenia than we know. Quite a bit of people are able to function just fine suffering from schizophrenia. And we may not even know that they have it, but others that we may see that are suffering from schizophrenia will be able to recognize their psychotic features, the delusional thoughts that they have. In that, we'll talk a little bit about some of the psychological treatments of this disorder. So basically, psychosis is defined by our textbook as a severe mental condition characterized by the loss of contact with reality. Delusions are false beliefs that we have, false thoughts, while hallucinations are false sensory perceptions. So false hearing things, false seeing things, false being things that we're being touched or hit when we're actually not having that sensory perception. So schizophrenia is a severe psychological disorder that's characterized by disorganization in thought, perception, and behavior. There's often is chronic disorder. There's a lot of variability in the symptoms and treatment, but we have this generalized area of psychosis of either delusions and or hallucinations. The positive symptoms of schizophrenia are things that are added to the person. Positive not being a good, but something positive means plus in this thing. They have unusual thoughts, feelings, and behaviors. The delusion, hallucination, the disorganized thought is added to them. These are the positive symptoms. The negative symptoms are things that are being removed from them. So they have diminished emotional expression, they have lack of capacity for pleasure, they have apathy, they have less speech, and sometimes some psychomotor retardation, in other words, some slow movements. These are things that are removed or minused from negative from the person. It ranges somewhere between 0.3 and 1.6 in the United States. There's a higher incidence of people who live in the city and for males. Another psychotic disorder other than schizophrenia that we need to talk a little bit about is the brief psychotic disorder. And that is kind of a brief break with reality. Where we have a person has delusions, hallucination, disorganized speech, but it lasts no more than a month. Sometimes can last like a day or two. Is a break with reality and somewhat of a obviously problem for them, but it does not reach the point where we can say the person is suffering from schizophrenia. Here are some delusional themes that individuals tend to report. Again, delusions are false beliefs. So how this happens is a lot of times we believe that there's some kind of abnormality or dysfunction or dysregulation in the neurotransmitters in our brain. The most common idea in this area is the dopamine hypothesis. And increased amounts of dopamine are associated with increasing psychotic symptoms. seems like schizophrenia seems to run in family. There's an increased percentage of probability of having schizophrenia if a first order family has it. Someone in your family has it. You can actually see some brain structural functional problems in people who are having suffering from schizophrenia. We used to believe maybe 40, 50 years ago that there was something called like a schizophrenic mother. In other words, that there was mothers that could cause schizophrenia, and there is no evidence that reports this, even though you may think that your mother drove you to be crazy. There's no evidence that schizophrenia is caused by parenting. Treatments of schizophrenia and the psychotic disorders are usually antipsychotics, things that help slow down the brainstem activity of our nervous system to slow things down. A lot of these drugs have some side effects that are difficult to deal with, but oftentimes are when we weigh the positive for the negative effects of these drugs, they come out that it's best for people to take them and deal with the side effects. Magnetic stimulation, again, we saw this in the use of depression, but it also is used here in schizophrenia for dealing with the positive um, aspects of schizophrenia, the positive symptoms. Again, cognitive behavioral therapy and psychoeducation are used. Oftentimes, group home is being used to help people get along and be able to work things through. Social skills training, helping people who are suffering from schizophrenia be able to know how to interact with others in a better way is helpful. Getting them jobs is often helpful. Social workers will do this. And we come to the end of our chapter. All right, hang in there. We're almost there. Thank you so much for being with me, and I will see you next week. Bye for now.